Atrial septal defect symptoms. What does having an ASD mean for you? If you have watched our first video, you know that the atrial septum is the wall that separates the upper chambers of the heart, the left and right atria. An atrial septal defect is a hole that is present in the muscular wall between these two upper chambers. Why is that important? Generally speaking, the pressure in the left atrium is higher than the pressure in the right atrium. Because the left side has a higher pressure than the right side, blood will flow from the left atrium to the right atrium. Over time, this will cause a series of changes in the right side of the heart as it has to cope with a chronic state of volume overload. This results in an enlargement of the right atrium and an enlargement in the right ventricle. When the atrium stretches, it results in a higher risk of atrial rhythm problems like atrial fibrillation and atrial flutter. When the right ventricle enlarges, it pulls the leaflets of the tricuspid valve apart, causing it to leak. Finally, the lung adapts to the chronic state of higher flow, and the pressure in the lung arteries may start to rise, leading to pulmonary hypertension. Pulmonary hypertension usually worsens as patients enter their fourth and fifth decade. Patients with atrial septal defect may also suffer more uncommon problems. Because there is a pathway to get from the right side of the heart to the left, avoiding the lung circulation, which at times serves as a filter, preventing particles such as small clots from reaching the arterial circulation, there is also a small risk of a small clot passing from the right side of the heart to the left atrium and eventually to the aorta, causing a stroke. We explain what patients experience in the following way. When you have an ASD, you are born wearing a backpack. Every decade, it is like adding a brick to the backpack. The weight is added slowly, so patients experience a slow and subtle worsening of exercise performance that is hardly noticed. Patients don't think it is abnormal. They just attribute the lack of fitness to getting older or being out of shape. In detailed exercise studies in adults, the increased exercise performance that occurs with ASD closure was clearly documented. After ASD closure, many hearts, especially in younger patients, will return to normal size and function. In patients over 40, the heart will shrink in size but does not always return to normal.